Okay, this is Dr. Sean Tierney. I want to go over the basic understanding of things go wrong with the neck, the lower part of the neck, the brachial plexus, and just get a good understanding of how we're going to deal with that. So what does it feel like if you have a brachial plexus problem? Maybe, and brachial plexus is the nerve roots from 5, 6, 7, 8, T1. And the most common thing that I think is going to happen first is going to have pain across your shoulders, pain between your shoulder blades. A lot of this mid-back pain is going to be coming from your brachial plexus. And I think of your brachial plexus, you think, well, that's my neck, right? But why is it in my back? But just think every muscle that moves your arm, whether it's your lat or your trapezius, that goes to your scapula, your pectoral muscles, your biceps, every muscle in your hand, your arms, your lats, your sartorius, your serratus anterior, all these muscles that move your arm, all brachial plexus, right? 5, 6, 7, 8, T1, mostly 5, 6, 7, 8. So let's just go through what that feels like. So the most common thing you're gonna have is this tension across your shoulder. Like I just carry the weight of the world up here. A lot of times that's the brachial plexus. We used to think, well, that's dorsal scapular nerve is coming back. We realized there's supraclavicular nerves even from C6 and C7 going back here. So what I find is it's anywhere from C5 to C8 is causing this interscapular pain. And that's one of the first places you feel it. Ironically, only about a third of those nerves are going there. I think more than 2/3 are going into your arm. So if I see C6 problems, then probably the most common place you'll first feel it is across your shoulder. C6 is coming out of the neck between C5 and C6. And that nerve root gets irritated as it comes out, possibly by a disc herniation, possibly by bone spurs on the vertebrae, possibly because of facet joints, irritation. I think of that every segment of the spine has an articulation with a disc and also a facet joint on the back that it's like the joints that a chiropractor would adjust. So the nerves are coming out between those two. They can get impinged coming out of the spine or in the muscles of the neck, sometimes because of adhesions or even colds or flus or lymph nodes that are compressing those nerves. So that brachial plexus first maybe across the shoulder, maybe then if it was C6 it would be in these fingers down the arm, down this arm to that first finger. So then C7, 5 could also be across the shoulder between the shoulder blade, but it also would be down to the middle finger and half of this finger. It'd be on both sides. Now, if it was a median nerve, the peripheral nerve would be one side or the other, but if it was a spinal nerve, it'd be more likely to be on both sides of the hand. Not necessarily always the case, but that can be a clue that that's where it's coming from. And then the C8 nerve root would be coming through here, half of this ring finger and the rest of the hand on both sides. So we have that C8 could also be across the shoulder. So what we tend to see is C5 tends to be around the deltoid, the upper arm. So we kind of see how this neck stuff becomes upper back stuff and eventually maybe arm stuff, eventually even weakness in the hands. And what we do to address that is we just look carefully at everything. So we can look at the nerve, we can push on the nerve, we can see if the nerve root's enlarged or not enlarged. Is the nerve root swollen? Is there lymph nodes around there? Is there a disc issue? Is there bone spurs? Is there arthritis in the facet joints? We can address each of those things with regenerative medicine to get the discs to the facet joints to heal. We can hydrodissect those nerves with just anywhere from saline to a regenerative solution to take the inflammation down for a longer period of time. And the most diagnostic thing I think for this brachial plexus is probably that hydrodissection of those nerve roots in the interscalene brachial plexus, which although requires a significant amount of skill and understanding of anatomy, is fairly safe when in skilled hands. With any infection, there's always a risk of bleeding. In fact, with any injection, there's a risk of bleeding, infection, nerve damage. When we have ultrasound, the whole purpose is we can see the vessels, we can see the nerves, so the likelihood of that happening is much, much lower. We can do something that's very, very safe in skilled hands. We can hydrodissect that nerve and we can see, was it C6 that was causing that pain? Was it C7? And we can see, not only the pain going the way in the hand, but also restoration of strength, power, grip in the hand and the pec. Not uncommon to have this, the pec get weak and atrophied when that C6 is irritated. Not uncommon to have, the scapula wing out if C6 is irritated. Could be other C5 or C7 as well. So we go through that pattern of understanding what's happening. So the one thing we'll do is we'll do the hydrodissection, we may do the regenerative medicine, and then we're gonna say, hey, your neck is hurt. Your neck is probably hurt because you're not moving well or you had a trauma. And either way, we wanna get you to move better and hold yourself in a better place. So we teach you how to get your posture back. Now, if my posture is here, where my upper back is further from my sternum, take a lot of the stress off of that C6, C7, that brachial plexus, because it spreads out further down. If I'm here, all that stress is going to be on C6 and C7, maybe C5. And the further I go forward, the more stress, and the more likely I'm going to have a brachial plexus stress injury in time. So I don't want to work here, I want to work here. I want to be athletic here. This doesn't look strong, I want to be athletic here, and that looks strong. So I want to get used to having that posture, get my spine away. I want to make sure I get those things hydrodissected, make sure I get the arthritis or the injuries treated before they become severe. When it comes to the neck or any part of the spine, including the joint, just like with most problems, it's not good if they get old. So I always say it's okay to get old, it's not okay to have old problems. If you have an injury, if you have a problem, address it when it's young, so you don't develop an old problem like arthritis, spurring, and nerve injuries. Regardless of old or new, if you have an infection, a lymph node can press a nerve, and a lot of inflammation in the neck from surgery or a lymph node, or sometimes for cancer, can cause those compressions too. And we can hydrodissect those nerves and make some dramatic changes relatively quickly for a lot of people. So that's just that lower part of the neck, across the shoulder, a little brief understanding of what's going on, why maybe your hand is weak or my hand is numb, why it's not moving. The typical thing is that people think that it's their carpal tunnel or their cubital tunnel that's causing their problem, and we just have to say a lot of times it is, but a lot of times it's coming from here, and we have a way with ultrasound to rapidly diagnose that and make some big changes for you. So that's that lower cervical spine.